Dr. Paul here.
Where are you going?
We're introducing you to a little baby 6 months old. I wanted to start off by addressing something that, as parents, we don't talk about it much. And that is, you've had 9 months preparing for this incredible baby, and then you learn that something's wrong. And that's not easy. And so we have a couple here. Thank you all for being willing to share your journey with us. It means the world. Maybe go ahead and speak to that. When did you first learn that something wasn't right, and how did that feel? And
I'll let him, because I was down and out, still upstairs.
Oh, really?
C-section.
So right away you
They
learned.
had a C-section.
Yeah, so
She was 7 days old when they checked her heart. They did. They were doing just a bunch of like hearing testing and things like that,
Yeah.
and they listened to her heart. They found a murmur. Ultimately, led to them doing an echocardiogram,
Right.
which is how they found the VSD, the hole in her heart.
Okay.
And then another 3 months later, I think we figured out that there was another artery that was 50% too narrow.
Okay.
So they had to fix that as well.
VSD is ventricular septal defect. The heart has two major muscles that pump, the ventricles, and when there's a little hole between them, the left ventricle that has to pump blood to the entire body is stronger than the right ventricle that just pumps to the lungs. So if they're both pumping and they do that in unison, when there's a little hole, a whole bunch of blood from the left, which is making more pressure, shoots across, and that's the murmur we hear. When you have a narrowed blood vessel, and I'm not sure which one it was, but you know, you have the additional problem of restricted blood flow, and if that's not corrected, then it creates all sorts of worsening of a condition, especially when there's a hole between the hearts, because one side was trying to push against pressure, so forcing blood the wrong direction, if you will. And now VSDs, ventricular septal defects, are the most common cause of murmur, number one cause. And most of those heal on their own, which is probably why initially they weren't like rushing to surgery.
Right.
So what happened between figuring out it was a VSD and then waiting a few months? Why did they end up in surgery?
That's when the symptoms really started to take effect. Her sleep was lacking. She wouldn't eat very much. And she was just generally very uncomfortable.
Okay.
So then they ultimately... Yeah, and then her breathing...
Breathing fast, not eating well, probably not gaining weight.
No.
Right.
Yeah, she dropped down to the 18th percentile in
Okay.
like 2 months.
Gotcha. So we can see now we've got a baby that's feeding really well, which is kind of cool. And we've had surgery. You can see a scar right down the chest. The surgery involved is, you know, it's somewhat of a big deal, isn't it?
It's okay. He's good. He's a good guy.
Dee Dee has the same surgery, so she loves working on babies that have the same basic issue. And how did things go with surgery?
They went how they wanted it to. Everything went well. She recovered well. The only thing was when they pulled out her tube from the middle, air went in when they closed it, so it went around her lungs. So when we went home the next day, we realized she was having a hard time breathing.
Oh, wow. Now we don't have to worry about this baby staying alive.
No.
Now
We
we
had
worry
a
about
successful surgery, right? Did the
Mhm.
follow-up tell you it's successful?
Oh, yeah.
Yeah. And I think what you went through initially was exactly what you expect with a VSD that was large enough to cause problems, right? So it was a large enough VSD. And that is, you wait and see if it's going to start healing on its own. But if babies start having trouble breathing and they're not gaining weight, you know you've got to do something. And then you had the double whammy of a vessel that needed to be worked on. And thank goodness for surgery and modern medicine in days like this.
Yeah.
Is this your first baby?
Yep.
Okay. And are you, it's perhaps too early to ask this question,
Yeah.
but are you thinking about other babies?
Yeah.
Yeah. Did you ask the surgeons what the chances are of a problem with the heart in the future?
They said it was nothing hereditary.
Correct.
So
Yeah.
there wouldn't be any concerns
No.
with a second baby.
Yeah. I would agree. It's minuscule. Yeah. So you can go into that next pregnancy when the time is right and not have to be fearful that you're going to have to go through this again.
Yeah, they kind of said everything that happened was pretty much a one-off of like,
Yeah.
this is very rare that
Yeah.
all of this happened.
Yeah.
and
So
she
how
got
did you all feel about that? What have you gone through?
stressed, I think.
Yeah.
Main thing.
Was the stress because of just the unknown initially, or?
Yeah, I think probably the unknown and just also like the like issues that you can't help with. Like
Right.
they're all things that
Feeling helpless.
yeah, you can't
Yeah.
do anything about it. And you just like they said we wanted to wait, but it's like okay, I don't want to wait. I want to get it over with because
Right.
I don't
Right.
want to
Fix my baby.
I don't want to be like, moms already have new anxiety, and then it's like, okay, she has a heart problem, and I'm like, are you breathing right? All the time, and
Yeah.
then we come home, and then they're like, and then we see her not breathing correctly, and it was sucking in, and so then we go in, and they're like, oh yeah, she has another problem, and we're just like, what?
Good thing you went in.
Mm-hmm.
Right. And that's just a little kudos to you and a pointer to viewers.
Mm-hmm.
Whatever the medical thing that's going on, if you go to the doctor, you've observed something that you're concerned about, and in this case they found something, but they didn't figure it all out. So if things aren't resolving as they should, don't just accept your baby's okay when things are progressing or not getting better.
Yeah.
And so you used your intuition and that mama instinct, daddy instinct to go, wait a minute, something's not quite right here. And then after surgery, did the weight gain return?
Oh yeah,
Yeah.
she's up to like the 45th percentile, so she went up to 40 ounces like a week or two after.
40 ounces a day she was
yeah.
taking? Wow.
And she was on that for about 2 months.
So that's some catch-up
She's
eating.
just now slowing down
Yeah.
to a normal amount.
Yeah.
And prior to surgery, it was a struggle to get 20 to 24 ounces
Interesting.
in a day.
Yeah.
It's amazing how bodies adapt, right? And so having gone through a period where she just couldn't because breathing was all important. If you don't have enough oxygen, you don't have anything left to try to eat.
I
think we're
And I think
team.
she's just too tired too.
I think we're
Yeah,
team.
you're exhausted,
I
right?
think we're team.
So yeah, we're
spinning
teething
up.
all right. And so
ourselves too.
that catch-up feeding that she did naturally, but she looks perfect, right? I mean, her height for weight is probably just spot on. Yeah.
No, she's doing great in that movement, all those things. It's just again when laying in one position or only on one side, you're gonna get that. But I think the thing that I pointed out last time to you that I wanted to make sure Dad sees is because of the way that it's elevated right around the base of the sternum. Just massaging in there and working in there, and especially the cupping, but kind of pushing on working on the back, like when she's laying, kind of working on the back to make sure that tension in the back sort of resolves too, but also kind of helping her with stretching, because right now with the back, like I've noticed she likes to hold her arms back. So again, when holding her, making sure both arms are forward and like the seated position, did you show him that? The seated position, that kind of thing. Just really paying attention to those things. Who is that? Is that Dad? Is that Dad? Really watching those things and those positions can help her come out of some of that tension. We don't realize how much holding her in the crook of our arm or facing up and having her head like that just reinforces some of that tension. And that's what we're trying to make sure that by watching those things, she'll start to outgrow it much faster than if you don't. And some babies don't end up outgrowing it.
You brought up an interesting point. The tension in the muscles of the back affect the
Yes.
sternum. And so, oh yes, you're paying attention to that too. You're getting a great massage. So yes, you massage along the spinous muscles and also in the front, and that will help that little protrusion not to get worse.
I know with the open heart surgery and again with having spinal issues, just even being older, how you can get really uncomfortable at times. That tension is there, and so it's okay to fuss. It's hard to record when you're fussing, but the idea is just to be able to move her and try and help her. Does her legs need to come up? Does she need to stretch the back a little bit? Does she need to have her tummy stretched? Just playing and moving with her, and sometimes then She didn't yet, but she can, sometimes they'll spit up because they'll go, oh, I caused her to spit up. No, it meant something was stuck there and you were able to get it to let go.
Well, folks, thanks to this lovely couple who allowed us to share their journey of having a child born, finding out there's a heart defect, going through major surgery, and coming out of it with a nice, healthy baby who's still got tension and some issues, but we're working through it. We have a healthy baby, and everything's going to be okay. Thanks for watching.